Hello everybody, my name is Mong Chin Wong and today I'm going to do a short presentation on the neurobiology associated with Down syndrome. So to begin with, I'd like to ask the question, what are chromosomes? So chromosomes are the physical carriers of genes, and chromosomes consist of DNA and associated proteins. The DNA in human chromosomes determine how we develop. So normal human cells have 23 pairs of chromosomes forming a total of 46. A gain or a loss of chromosomes from the normal 46 is called aneuploidy. A common form of aneuploidy is trisomy, or the presence of an extra chromosome cells. Tri is Greek for 3, and people with trisomy have 3 copies of a particular chromosome in cells instead of the normal 2 copies. So people with Down syndrome typically have the 3 copies of chromosome 21 in each cell. Next, I want to move on to the epidemiology of Down syndrome. Down syndrome is the commonest, most chromosomal disorder worldwide. It occurs in all countries and includes all races and both sexes. The leading genetic cause of intellectual incapacity worldwide, it has a reported incidence of about 1 in 1,000 live births. John Langdon Down was the first physician who did a complete description of clinical features of the syndrome in 1866. Thus, the disease was named after him. So in the meantime, studies to determine the prevalence, cause, and clinical significance of the syndrome have been conducted over the last 100 years. The occurrence of Down syndrome is multifactorial and includes both genetic and environmental factors. The maternal age at the time of conception, increasing father age, and short intervals between pregnancies can all cause Down syndrome. Then there are acquired factors such as exposure to environmental chemicals, toxins, drugs, cigarette smoking, ionizing radiation, maternal autoimmune diseases such as gestational diabetes, thyroid autoimmunity, nutritional deficiency, even the irregular dose of oral contraceptives. So DS or Down syndrome is a result of the full human chromosome 21, which is an outcome of the inability of the chromosome to segregate during meiosis in a developing ovum or even in sperms, culminating in an extra copy of the entire human chromosome 21 in all cell types. There are neuropathological changes occurring in the fetal and neonatal life, leading to alterations in brain development. And then there are neuropathological features in Down syndrome adults that lead to early aging, senile dementia, and also Alzheimer's disease. For young children, the neurodevelopmental abnormalities determine delay or failure in the acquisition of motor skills, speaking, reading, and short-term memory impairment and learning difficulties. So the brain, next I want to move on to the neurobiology of Down syndrome. The brains of DS people have structural and functional abnormalities with developmental alteration in morphogenesis such as reduction in the brain volume, including the cerebral gray and white matter and cerebellum. And then there's delayed myelation, lower neuronal density, and abnormal synaptic plasticity. So Down syndrome is considered both a neurodevelopmental and a neurodegenerative disorder. And in this slide here, you can see the neurobiological alterations in Down syndrome, including impairments in GABA anaerobic transmission, increased oxidative stress, inflammation, and hyperactive homocysteine transsulfuration pathways. And all of these contribute to cognitive impairment. So next we move on to the clinical features. They include mental retardation, weak neuromuscular tone, gastrointestinal problems, audiovestibular impairment, visual impairment, dysmorphic features of the head, neck, and airways, and a higher incidence of other medical disorders. So quite often you can see in Down syndrome children, the small and flat nose bridge, the single palmar crease, and the difficulties with language cognition and learning memories. Down syndrome comes with many diseases such as cardiac heart defects and blood disorders, as well as leukemia, gastrointestinal diseases, obesity, obstructive sleep apnea, even seizures, increased likelihood of that, and respiratory disease. There are several screening methods that mothers can receive from hospitals. These include maternal age assessment, imaging markers in the first and second trimester or ultrasounds, maternal serum biochemical testing, and analysis of cell-free studies. Then we move on to the treatment and the management. At present, there is no cure for Down syndrome, but what needs to be done is multidisciplinary. Young children should be referred to a clinical, with their parents, to a clinical geneticist for counseling and testing, and they would also definitely fare better with support from a young age in schools and centers of learning, as well as speech therapy, physical therapy, and so on. Next slide will tell you the medication for Down syndrome, and the list includes Burlantine and Florentine and Memantine. In conclusion, recent medical advances have prolonged the lifespan of most people with Down syndrome to greater than 55 years in economically developed countries, and ongoing research continues to be implemented on DS to improve testing methods and the invention of new medications for patients to help improve their lives. Thank you.